spinal stenosis involves losing space inside the spinal canal. Just like you can have stenosis of the freeways when there's a lot of cars going through, same way you can have encroachment on the spinal canal. Now, it's most common in the lumbar part of the spine, which is the lower back. Degenerative changes can take up space inside that canal. Less space means more pressure on the nerves and thus more irritation. Spinal stenosis can come with pain, and if it does, mostly it is felt at the back or the legs. But spinal stenosis may not cause any pain at all. It can cause more intensive symptoms such as progressive weakness in the lower extremities, again, meaning the legs. If it gets bad enough, it can also cause some bodily functions to lose control, such as the bladder and the bowel movements. The main cause of spinal stenosis is degenerative arthritis or instability in the spine. Some of the symptoms of spinal stenosis could be numbness into the legs due to pinched nerves, loss of motor function as well into the lower extremities. The symptoms are mostly, as you might take notice, is caused by squeezing of the nerve root. Symptoms, again, most oftenly occur in the lower extremities or the legs. Standing or walking can sometimes exacerbate or make your symptoms feel a lot worse. Spinal stenosis is predominantly diagnosed with either an MRI or a CAT scan, and it's reviewed by a radiologist and discussed with your primary care. First and foremost, spinal stenosis can affect the neck, mid-back, or the low back. Depending on what parts of the body it affects, you may get different types of symptoms. Some symptoms that may be an effect of spinal stenosis of the lower part of the body, meaning the lumbar, could be difficulty with walking. Sometimes you may even be able to walk shorter distances, but you tire much quicker than you normally might. Spinal stenosis can also affect the neck and upper back. With those, you may get more arm and hand symptoms. Spinal stenosis generally affects the older population, so we're looking at 60, 70 plus. As we age, there's more chances of degenerative arthritis, which can cause spurring and consequently spinal stenosis. Spinal stenosis technically cannot be cured, but with enough activity modification and good therapy, it can be managed. And if it gets bad enough where you're seeing severe symptoms, surgery may be warranted. Going back to what we spoke about earlier, if spinal stenosis gets severe enough, then surgery may be recommended to a point where the surgery will be needed to free up or decompress the nerves, causing less inflammation, less irritation. Something called decompression fusion may be performed. Surgery is indicated with advanced arthritis leading to pinching of the nerve or instability of the spine. Remedies that you can do to prevent getting to a point of surgery would be chiropractic treatments, acupuncture treatments, physical therapy. That would be like the best three-prong approach. The chiropractic is great there for really loosening up the joints, taking pressure off the nerves. Where the acupuncture comes in is decreasing inflammation and irritation around the nerves. And eventually you're going to want to strengthen those muscles and ligaments around the spine to help hold the structure. So physical therapy or rehabilitation is important, mostly long-term. So again, chiropractic, acupuncture, and physical therapy are definite must with spinal stenosis. Other things that could definitely be beneficial would be palliative care, such as massage therapy, as well as flexion distraction types of exercises that can help pump the lower back. And this pumping mechanism with these flexion distraction exercises can help get nutrients and water through an imbibition process to the discs to help really get all the nutrients to the discs as quick as possible. So in addition to doing the recommended therapy, it's important to keep active, keep moving, and keep things fluid. So that would mean, going on daily walks, and it would be recommended more flat walking, so avoiding hilly areas and high elevation. Other things that could be very beneficial would be swimming. Swimming kind of helps take the weight off the body and takes your joints through full ranges of motion, loosening up the area, de-inflaming the area, making sure that you have good, again, sleep ergonomics, as well as sitting and standing ergonomics. So it's important to get an ergonomic professional to possibly take a look at your setup, to make sure that you're doing everything you can, possibly not to irritate the area any further. One thing to note is that when spinal stenosis gets bad enough, it can cause radiating symptoms. So symptoms down the legs, as well as bowel and bladder dysfunction. If we get to this point, it is really important to get to the emergency room as quickly as possible. This could indicate a surgical intervention, and that's probably what I would recommend at that point in time. Are you suffering from spinal stenosis? It might be important to get a professional to take a look at your case. Give us a call at 415-421-1115.